Hi, Ashton.
Hi Harriet, so I have a few questions. My first question is, what is occupational therapy? I know you've been doing it at uni, so what actually is it?
So, essentially, occupational therapy uses activities, or as we refer to them, occupations, as our medium to engage people that are disadvantaged in some way. We can also help these people to engage in occupations that they, for some reason, aren't able to participate in.
Right, so when you say occupation, you mean their work?
Not necessarily, although it can mean someone's profession, it can also mean any activity that is meaningful to a person. So, to make this simpler, we categorise these things into either self-care, productivity, and leisure. So let's start off with self-care. Self-care activities can mean any activities of daily life which are quite simple but are of great importance to us. Things like showering, eating, going to the toilet, and even dressing yourself independently. The other part of self-care is instrumental activities of daily life, which are more orientated around activities that gain your independence. So things like managing your own finances, driving a car, shopping for your own groceries. Now these may seem like things that come pretty easily to a person, but for say if you had just had a stroke that affected the right side of your body, then you couldn't actually use your right hand, and it can make things like, doing up zips, doing up buttons, dressing yourself really hard. So we would implement strategies to help you do those things independently.
Okay, so what about the other things you mentioned, productivity and leisure?
So productivity refers to contributing and engaging in society. So this can mean either going to paid work or unpaid work. And by unpaid work, I can mean, yes, volunteering, but it can also mean caring for others, such as your pet, like Poppy, or your children, if you had any. And lastly, leisure refers to the activities that you do not have to engage in, but one chooses to, like your art, your netball, or going to the pub with me.
Cool. So it sounds like you guys work with people with different disabilities. Where would someone go to see an OT?
So, occupational therapists work in many different settings, such as nursing homes, private practices, hospitals, workplaces, and also in the client's homes. We are a very client-centered practice, which means our job relies on what the person wants and what is important to them. So because of this, it can even mean having meetings where they feel most comfortable. So that could be in a park, at the beach, just anywhere where the client wants it to be. It's all about what they want and what makes them feel safe and respected.
Okay. So what makes you guys different from a nurse or a physio?
So again, our importance of client-centered practice is really what makes us different. When a doctor goes into a patient's room and looks at the chart, there's nothing on there that says Ashton is a sister, she's also a daughter, she likes netball and she likes going out with her friends on the weekend. She also paints and draws on a regular basis. Context and meaningful activity is a huge part of someone's life. So when a doctor prescribes medicine or a physio prescribes stretches X, Y, Z, they're focused on the body and what is actually wrong with it. Our main goal is to help people pursue what is actually meaningful to them. So if you hurt your hand one day, Ashton, the fact that you like to paint and draw is everything towards your recovery and is everything to us.